I'm Ella and I'm going to be doing the IV pass-off. So I looked in my patient's chart and they have an order to place an IV. So I gathered up all of my equipment and now I'm just going to go into my patient's room. So knock, knock, knock. Hey there, I'm Ella. I'll be your nurse today. Just going to get this up here and then kind of talk to you about what we're doing. Before that, can you tell me your name and your birthday? Perfect. That matches up. And can you tell me if you have any allergies to any kind of adhesive or any medicine allergies? No? Okay, perfect. So your doctor has ordered an IV for you because you're so dehydrated. So it's just going to be a little needle, but the needle's not going to stay in your arm. We're just going to poke you, and we're going to put a little flexible plastic tube in your vein, and it's going to help give you some fluids, okay? Does that sound okay with you? Okay, and if you ever get too nervous or you need to take a break, we can. And I'm here if you want to talk about any of your fears or anything, and I'll talk you through it and make you hopefully feel as comfortable as you can with this. Are you okay if I get started over here? Okay, perfect. I would shut the door and the curtain, do some hand hygiene. And then I'm just gonna get some things set up. We gotta make sure we have our sharps where I can reach it, so I might move it down. I'm gonna get everything opened up. And this surface is all clean. Alright, I'm gonna open up our start kit. Going to wipe off this part with an alcohol wipe and then connect a flush and prime it. Oh, there we go. And then I'll probably clean that actually. Back on. Then we're just gonna set this where we can reach it. Let's see, make sure we got everything. I'm gonna rip off some tape so it's close. Okay, I'm gonna just pull up this chair. I'm gonna make sure that my patient's in low Fowlers. They look pretty good. I might move up barely. Make sure that I'm at a good spot with their arm. And then I'm gonna look over, look at their veins and see which one that I'll try for. I'll try this one. So I'm going to get a tourniquet. I'm going to tighten it 3 to 4 inches right here. Or while I'm doing it down there, I could just go lower, but perfect. So I'm gonna clean like 15 to 30 seconds. And let it dry. I'm gonna say that's pretty dry. I'm gonna anchor it here, and then with the bevel up, I'm gonna go like 1 to 2 inches above there. We're gonna stick it, and I'm gonna drop it a little bit, and then I'm going to advance the catheter and pull back. See if we got anything. I don't think we got her, so sorry about that, sir. We're gonna do you again. Alright, so I would get like a new one of these. And then we're gonna feel around. Try it like right there. I lost where I was. Let's see. I'll go there. And let it dry. I'm not gonna fan it. Sorry, sir. That's not fun to get poked again. Hopefully this time we'll get it. Sorry, man. Let me feel on you for a minute, and then we'll try. I'd get a new one of these, of course. And if I needed to like clean up anything, I would. Goodness. I wouldn't have done that. I would have just twisted it. There we go. Throw that one away. And then, that's not a self-occluding one. I'm so sorry, sir. We're going to get this part. And then we're just gonna flush it. Oh, make sure it doesn't come out. We're gonna do 5 to 10 milliliters. And I'm just gonna clamp it here in case any blood comes back. And then we're gonna put on Techoderm. Got a little bent there. Yeah. And then I'm gonna take this, tape them. Oh, and this, when I would have pulled out the needle to put in there, before I would pull it out, I would have released this. Pulled out, threw it away, and then continued on. Now I would just make sure I have everything cleaned up, and I would change out this pad and get a new one. Or actually, I wouldn't need one. I'll just take it out, throw it away, throw all this away, and then I would label this with the date and the size and the type and my initials, and I would just stick it near here somewhere. There, right up there. And then I would just do hand hygiene and go document.